Hi everybody, can you hear me well at the back? Yes, good. My name's Kyle Gibbs. I'm the National Nursing Manager at Helios Limited, and I'm also a university honours student. And this is the first time I've done a research paper and a study, so please be nice to me. There's a couple of people in the room that I wish to acknowledge as well. There's some of my nursing team here at the back, and my mentor from university is also here, Peter Sinclair, that's really helping me build this research paper that I'm working on. So what we're looking at is the barriers and facilitators of graduating nurses entering into primary health care. And the reason I chose this question is with my current workplace, we don't have very many graduate nurses entering into our workforce. And I saw that there was a real need for me to be able to challenge my peers at my workplace to get these nurses into our workforce, but also I saw that there was a real need to find out why they're choosing not to enter. Some of the research that I did when I started forming my question, it sort of showed that over the last decade there's been a huge decrease in graduate nurses finding employment, full-time employment, straight after graduating. The recent graduate outcome survey was just released last month, and it's even dropped further. I think it's sitting around 78% of new graduates do find full-time employment within 4 months. So there's a big cohort that aren't finding any employment, and that's an opportunity for primary healthcare providers because somebody said that we're wanting to increase our numbers nearly double the amount that we currently have, and to do that we need to really be looking at this cohort of nurses to bring into the workforce. The aim of this study was to identify the barriers and facilitators of student nurses entering into primary healthcare post-graduation. For some reason my notes aren't coming up on this screen. Is there a way I could get that to come up? Oh, okay. Yes, no, it's all right. So I'm going to have to completely ad-lib this, so this is going to be awesome because all my notes were on the bottom, so good luck with that. Yes, practice makes perfect. I'm actually from the Central Coast, so your study was really good to participate, to see. So the methodology was qualitative. We did an elicitation study which was informed by the framework of Francis in 2006. We wanted to find out the beliefs of the graduating nurses choosing the career, and so we designed an online survey and we shared it with the third year nursing students at the University of Newcastle. And we had that open for about a month, and we had an overwhelming response. We originally wanted to only get 30 students enroll in our study, just because this is my first study and I don't want to be overwhelmed with so much qualitative data. But also we were monitoring it to make sure that we reached data saturation. So we actually got up to about 52 for this study, so 52 nurses participated. There was 9 basic demographic quotes, and then there was 5 open-ended questions which were targeted at identifying those barriers and facilitators that the nurses felt for them to enter into primary healthcare. That's exactly what I just said, so there you go. Jumping ahead. Pete and I met quite regularly to discuss how we interpreted the data. A lot of back and forth debates happened with the two of us, especially around how we developed these themes that I'm about to share with you, and the sub-themes, and the percentages that I'm going to share with you as well. When we're going through it, we coded the results based on keywords and phrases and concepts, and then that's how we got to our discussion. So the main facilitators that we found in the study was, the main things were new graduate opportunities. So if there was a new graduate position within the primary healthcare network, they were more likely to choose to move into that field. If there was the offer of professional development as well as well as more exposure in their studies, also help facilitate them in choosing a career in primary health care. We then identified some sub-themes with that. So there was specific mention about the new grad programs and a lack of new grad programs as well. So that correlated to our barriers as well that I'll share with you. Career satisfaction was very important to new graduate nurses, knowing that they could have an impact on a patient's life and knowing that they could actually practice evidence-based medicine when they go into the general practice environment. At the University of Newcastle, there was a cohort of mature age students as well, and a lot of them identified that they wanted increased flexibility, especially around the hours that they worked. Increased support, so not having to start a career by themselves, having to have some support and some mentorship was very important to them. And there was a mention of improved remuneration, so increased pay. Company-supported continuing professional development, career progression, offering a career pathway for the nurses, and an increased scope of practice was very important to them. Facilitators were also, within their university degree, if they had clinical placements, they felt that they were more able to make a choice either towards or away from primary health care. If they were provided with more information that was relevant as well. And they also identified that if there was a lack of skills in the primary healthcare environment that they're about to enter into, that would detract them from entering the career as well. Some of the quotes that we received from the study was that for the new graduate opportunities, one of the participants stated that jobs for new graduates or programs with additional study for that role, it seems a lot of the roles advertised want experience. That was a huge barrier for them. But yeah, that was key. It was interesting, from the University of Newcastle, 64% of them shared that they had had no clinical placement within the primary healthcare setting, which was really discouraging. And one of the students that actually did have a primary healthcare placement actually reported that that placement was in a canteen at a school. So not that appropriate. So there's a lot of work still needing to be done in terms of developing the tertiary side of advocating for primary healthcare nurses entering into the career. Professional development quotes that were shared as well. A lot of the nurses were mentioning that they need to have some sort of protected time when they first start out their career to seek that development that they need to further their career and also become really strong. I think I've mentioned this before, but more exposure. So a lot of the lecturers at the University of Newcastle need to mention primary healthcare more in their discussions, and also as being a career option as well for the future. With the barriers, we split them between the industry, what the industry needs to work on with these barriers, and what the educational institutions need to work on. So with the industry, it's very clear that low pay is an issue for graduating nurses with their career choice, knowing that there is a framework for that pay and that they will increase. One of the barriers was that perceived smaller scope of practice. Again, no graduate positions being offered. A lot of the roles advertising for nurses are always asking for experience in the general practice environment. There was less opportunity for progression, lack of skill consolidation, and there was this perceived notion that there was a less demanding career. Educational institutions need to provide experience to these nurses during their qualification, give them increased exposure, provide clinical placements, actually stop that myth out there that happens, which unfortunately a number of the nurses that did participate in clinical placements reported that nurses in general practice were telling them they need to go into the hospital first to develop their skills before coming into the general practice environment. general practice is advancing quite rapidly. Scope is increasing, especially in the clinics that we have in Helios. We've now seen nurses doing suturing, we're now seeing nurses doing cervical screening. We're trying to utilise our nurses at their full scope. We've even got IV therapy now coming into general practices. I think a lot of people are seeing iron infusions becoming quite regular, which was not heard of before, IV therapy in general practices. So there's still this myth around you can't develop your skills, which needs to change, especially with our own colleagues. Some of the quotes that were shared assumes smaller scope of practice, limited opportunities, no information provided in their sessions about the primary health care. It was almost that a lot of the participants said that they were pulled into having to go towards the hospital graduate programs or needing to go in that way, and that's through their team of educators. There was also a lack of information on the possibilities out there. No placements is a really poor thing within the university curriculum, and that definitely needs to change in a lot of universities. But there are a lot out there that have made these changes already. Participant 16, you can see there clearly that they've been told by a nurse within the general practice environment when they've done their clinical placement that they need to go into the hospital. That really needs to change. The reason that I started this study was to basically identify the barriers and the facilitators, to inform stakeholders to address what these are, aim to try and build a stronger nursing workforce for the future, and make people consider how they can play a role in advocating for the change. The way that I've done it within my own workplace is we've now got a number of agreements with some universities and taking on student placements, which I think is very important. We're reviewing the pay that we pay our nurses. We're talking more to other nurses and other universities about what we perceive to be a major issue in terms of getting graduates into the field. But there's a lot more that needs to happen, and yeah, that's it. Thank you. Is there any quick questions or maybe for the end?
Please, thank you so very much. That was absolutely awesome.
Oh, thank you. Thank you.
It's young people that, with fresh perspectives that we need to hear from. I'm really keen to hear your feeling about, I feel we need a structured national new grad program for general practice. Because there are new grads working as solo nurses in general practice.
Yep.
And that's not fair to them or the patients or anybody. Do you feel that that is a potential option for the future? Are we heading there?
Well, I'm going to talk about my workplace because the workplace I work for, we have 76 medical centres and we look after about 450 primary healthcare nurses. And that's exactly the discussion we're having at the moment about having a national framework for our nurses to be able to tap into to have a graduate program. We're in a very unique situation at my workplace that we're like those mega clinics that you see. So we can actually provide a structure around nurses starting in the treatment room and then moving into skin cancer, occupational health, then moving into the chronic disease management space. We also have the opportunity for the nurses to progress into IVF and day surgery and sort of offering a rotation that you sort of have in the hospital as well, which I think is key for an attractive pathway for the nurses. A lot of the time, the frameworks are developed around just getting them into the treatment room environment, but we need to acknowledge that these nurses are wanting to have experience and they're wanting to progress with their career, and just being in a treatment room isn't enough for them. You want to have a framework that's attractive and that's going to engage them and develop their career further, and that's what we're we're discussing at the moment, and working with the other heads of nursing in the day surgery, in the IVF, and in the skin cancer and occupational health sector, which all are part of primary health care. Yeah.
I've been running a grad program for 11 years in general practice, and very successfully.
Yeah, and I love this. I think it's great. But if each little section's doing their own thing, then it's not going to work in the long run. That's why I think it needs to be nationally structured. Tuesday next week is the education consultation with APNA in Sydney. Are you going, Kyle?
Monday's my birthday. It's my birthday. I'm having it off. I'm sorry. Oh, is it the Tuesday? Oh, sorry. I just had to get in that it was my birthday. Actually, on the Tuesday, we're meeting Ken, the CEO of APNA. So I've already got some meetings booked in. But yeah.
Try and make contact with you and maybe with Pete and see maybe we can talk about some of your stuff at that project. Yeah.
Thanks.
Thank you.
Thanks, Kyle.